So again, welcome to the Kern County Breastfeeding Coalition meeting, and we're going to go ahead and start off with introductions. If you can please tell us your name, your organization, your job title, and where would you travel this summer, or where have you traveled this summer, or where would you like to travel? So I'll go ahead and start. My name is Jasmine Mendez, and I'm the Regional Breastfeeding Liaison, also the co-chair for the Kern County Breastfeeding Coalition. And I represent all of the WIC agencies here in Kern County. If I actually haven't done much traveling, which I'm kind of sad, but if I could travel, I would travel to my parents' hometown in Mexico, Jalisco and Michoacan. I can't say enough. The food, the weather, I just love it all. And I'm going to go ahead and turn it over to Janet.
Hi, I'm Janet Barrett. I am lactation at Kern Medical and co-chair of the coalition. And I didn't go anywhere this summer because I went to Scotland in March and went home to see my family there. So that was my trip for this year. So this summer, I'm just working. I'm going to pass to Devini.
So hi, my name is Devini. I work for the CalFresh Healthy Living Program as a health educator. And last month, me and a friend went to Vietnam and Thailand. And it was great. It was amazing. I wish we could have stayed longer. And then I don't know, Deanna?
Hi everyone, my name is Deanna Lara. I work with Clinica Sierra Vista. I'm a case manager with our AFLP program, which is a program that assists parenting youth and pregnant youth. So where have I traveled? Last month, I was able to go to Washington State. It's really beautiful out there and it smelled amazing. I still have more plans to travel this summer, but I just haven't decided where exactly, probably somewhere cooler though. So we'll see. So I'll go ahead and pass it on to Elena.
Hi everyone. So I'm an intern with the California Health Collaborative, working with our PPC and just kind of getting to know a little bit more about the different coalitions. I haven't traveled anywhere so far, but I'm going to be traveling like in-state to like Santa Monica and San Francisco, just a little near the coast, which I definitely appreciate during the heat. I'll go ahead and pass it on to Bania.
Yes, thank you. So my name is Bania Parra. I'm one of the health education specialists with Kern Health Systems. And I haven't done much traveling this summer either, but like you mentioned, Elena, just going out to the coast, nice weather, and that's really right now where we can travel to because we are waiting for passports for my kids. So once we get those, we do plan to head out to see some of my family from my mom's side since they haven't met yet. So that's something that, you know, we really would want for my children to meet in person, my mom's side of the family. So hopefully in the near future, but for now, probably just beach trips, you know, on the weekends when we can. So thank you, and I'll pass it on to Lori.
Hi, I'm Lori Ochoa, and I am an RN IBCLC. I am in private business right now with Lori's Lactation Station. I actually got to go to Israel a couple of months ago, and it was an incredible trip. My husband took me on, loved it. And Janet, I love Scotland and all those people there too. So no wonder I think so much of you. And
thanks, Lori.
I'll pass it to Catalina.
Thank you, Lori. Yes, so my name is Catalina Lemus. I'm from the Employment Development Department, Migrant and Seasonal Outreach Program. And I'm also the new member for the California Breastfeeding Coalition board member. And yes, so to answer the second question, where have you traveled this summer? I just came back from vacation, actually. I went to Mexico. I went to the city, to the capital of Guanajuato, which is Guanajuato. And yeah, I did a lot of, because I'm a historian at heart. So I did a lot of like museum trips, and I went to go see the National Archives, which was super cool. I saw a lot of like maps. They let me see a lot of maps, a lot of like records. It was pretty fun. But yeah, I would pass it to, I don't know, because I did come in here a little late. Have you gone, Elena?
Yes, I have.
Who's left?
Hi, good
Whoever
afternoon.
has-
This is Flor. I'm here from Kern Health Systems. I'm the health education supervisor, and I'm just here to hear a little bit about what the coalition is doing. Thank you.
Thank you so much for everybody, excuse me, for sharing and for being here, for taking the time to come and join us. So we're going to go ahead and start with the meeting agenda. Bania is going to be going, Bania, the health education specialist, is going to be going over a baby steps program from Kern Family Health Systems. So Bania, I'm going to go ahead and share your PowerPoint. Let me just stop sharing real quick. And pull this up. Okay. And I believe Priya, you just joined us. Welcome.
Oh, hi. Thank you. Yeah, I couldn't actually, it was asking for a passcode and I didn't read your email. So
Oh,
my
no worries. No worries. That's
Sorry.
on my end. I'm sorry. And if you wouldn't mind, Priya, telling us your, well, I just said your name, but your title and, you know, your travels plans, if you've had any this summer or, you know, wish you did.
Oh, okay. My name is Priya Kuller. I'm a registered dietitian and lactation consultant. I work with the KCBC program as breastfeeding education coordinator. So I just completed my travel plans, actually. I went to visit my parents in India, and we stopped in Amsterdam for a few days. So with my younger daughter, so it was a lot of fun. Thank you.
Thank you so much, Priya, for sharing. And now we're going to, okay, can everybody see my screen? Perfect. So Bania, I am passing it on to you.
Awesome. Thank you so much, Jasmine. So yes, thank you again for the opportunity for me to take some time to share a little bit about our Baby Steps program. And then I know Flood mentioned she's here as well. So she's joining us for today, our health education supervisor. Can go on to the next slide. Thank you. So, and again, I know I mentioned earlier, I'm one of the health education specialists here with our health education department with Kern Health Systems or Kern Family Healthcare. Here we do have our goals of the program. So we do encourage our pregnant and postpartum members to have prenatal care or perinatal exams on a timely and consistent basis. Also to decrease the incidence of premature births and low birth weight babies, and then also to improve our prenatal and postpartum MCAS rates. So for these rates, they are the managed care accountability set rates, and with these, they are measures that are set for us as a Medi-Cal managed care plan to you know, look into different aspects of healthcare, so preventative care, also with access and availability to care, utilization and relative resources, things like that. So some of our activities here are to identify members early on in the pregnancy. So we do outreach for our members, whether it's over the phone, over text messages, or in the mail. Also, some of our education that we provide to our members is through different materials, presentations, also providing that information at different retail stores, as well as health and resource fairs. We do inform our members of our member reward programs, which I will talk a little bit about throughout our presentation, but as well as making any referrals to different programs, providing them with information on these programs and different resources for their health needs. And then we also provide that education to our members of for our providers through our portal, and then just continuing to expand and maintain our partnerships throughout the community. Next, please. Thank you. And then I think you can click one more. Okay, great. So some of our outreach and our education to our members does include phone calls and assessments. So during these phone calls, we do reach out to our prenatal and postpartum members. So with the prenatal members, as this does include our teen members, members in their first trimester, and then those that are self-referred. As well as for postpartum members that have had C-sections or also are self-referred. During these calls, we do conduct assessments. Some of the questions do include questions referring to if the member is breastfeeding, if they have had their visit with their doctor already, if they need any assistance with scheduling their visits. So again, just to ensure that they are, getting those visits in during their pregnancy, or even for postpartum, making sure that they do follow up with their doctor. Along with this, when we do the phone calls to our members, we do 3 attempts. We do a follow-up letter, again, just making sure that we are doing everything possible on our end to get a hold of our members. And then along with that, we do also conduct the PHQ-9 assessment. Again, some of the doctors, if they have had their visit, have maybe already, been asked these questions or maybe not. But again, we just want to ensure that we do that on our end. And then if a member is in need, then we do the referrals within our departments to behavioral health if needed. So again, with our outreach, we do mail information. We continue to do the community presentations. We're part of health and resource fairs, and then also pre-recorded calls or text messaging that our members get once we get those, information, whether a member had a recent delivery or has become pregnant. With our educational materials here on the left, we do have a brochure. We are currently updating our brochure. It's near finished, but it's still in the works. We do have a brochure to provide our members, as well as information through our Kern Family Healthcare website, through the member portal where they're able to obtain this information, as well as through social media. And then we also have pregnancy health guides that we do send our members. And along with that, we're sending out still the COVID-19 question and answers flyer, and then our member rewards flyer. So that may change a little bit, just because we still, again, I know COVID-19 was, the big talk over the last few years, but we still want it to be just as important, where members are informed along with other vaccinations. But again, this is what was included with our mailing for our members. And again, if anyone does have any questions throughout, feel free to, stop me at any time, or we can also answer questions at the end. And so this is our there are pregnancy health guides. So with the health guides, they are personalized to our members. So it does have our members' information, also milestones for baby and for parent. And then we have additional resources along with the guides. So again, this is another project that we are working on with making updates to our guides, both the prenatal and the postpartum. So in some of the guides, we do have where members are able to take note, for example, if they are having, getting their hospital bag ready, to make sure they have like their checklist, as well as if, they're going into their doctor, they have any questions. We also have just an idea of the milestones as well for, the pregnant member as well as for baby. So just gives, our members an idea of how baby is developing, as well as for the parent to see, what to expect throughout each trimester. So we have a lot of good information here. We also share different resources. So if a member has any questions, or just in regards to, again, mental health, safe sleep, things like that, we also have that included in the guides. So the first one here to the left, that's the postpartum. And then to the right, you see here a belly, that is for prenatal. And we do send these out once we get those claims from our members that they are pregnant. And again, we send these out through the mail. Next, please. Thank you. And then, so here we have our member rewards. So we do offer our Kern Family Healthcare members rewards for taking care of their health, along with anyone else in their household who is, members of Kern Family. So what is neat is that we actually have 2 rewards that our members may qualify for per pregnancy. So here we have our prenatal care reward, which is if our members do receive prenatal care during the first trimester, they do receive a $50 Walmart gift card that is based off of claims data that we have in our system. And they're also able to submit a prenatal reward form, which I will also have a picture of, so you kind of get an idea of what that looks like. But again, we're also able to get that data from claims here on our end. And then for postpartum care, as long as our members are having their visit 1 to 12 weeks after delivery, then we send them another gift card, and that one is for $30. So this one is just based off of claims. Members don't have to submit anything. Again, we just go through the claims and ensure that member received that care 1 to 12 weeks after they have delivered. And then here, and just quickly, we have other rewards that we offer as well, and they're noted on that reward form. So this is the prenatal reward form that we ask for our members to submit. Just member information at the top. It has some brief information as well as far as the gift card rewards information. And then for their doctor to use, our members don't necessarily have to take it within the first trimester. Let's say they just found out about it, second trimester, but they did have that prenatal care during the first trimester. They're still able to take it into their doctor as long as the date where it has a question right under the for provider administrative use only. It does have, has member completed a prenatal care visit during first trimester, and then the date will be there. So we'll use that to verify as well. When we go back on and look at our claims, we're able to determine that the visit was completed. So we'll just get provider signature information. And then again, the members are able to access it through our website. And if we are doing those outreach calls and they aren't able to, print it, or they're just not able to get a hold of it, we're also able to mail it out to our members, and they can either mail it in, fax it in, or turn it in person at our building. So here we have the links for the prenatal form, and then we just have description and information on our measures as well. So again, right now we're just for the purpose of the presentation, we're just focused on the prenatal and the postpartum. But again, we do have those measures as well that, cover those aspects of, healthcare, again, preventative care, management, access, and all of that good stuff. So those links are available here on the presentation. And then just another way, of course, to help our members is just ensuring that, we're assisting with scheduling that first prenatal visit as soon as the pregnancy is confirmed. So sometimes, we do get the claims and members received a call and they're like, hey, how did you know I was pregnant? Or sometimes, like they may have a visit, even let's say at like the urgent care or whatever the case is, and maybe they weren't informed at the time, but we're the ones giving them that first call. If we're able to assist right there and then to have an appointment scheduled, we're able to assist in that way. We have realized that our members also do prefer to receive those text messages as reminders, from their doctors or even from us, maybe, something that we're also trying to implement, where we have those text reminders like, hey, make sure to go to your, postpartum visit or your prenatal visit. And over a survey that we did last year, about 80% of our members, again, did prefer the text message over the phone calls. So along with that, assisting with referring members to maternal health programs with Kern County Public Health, which include Black Infant Health, Nurse Family Partnership, POP program as well, and then of course WIC. And I just want to mention during our outreach calls, I know Jasmine, you did share with us that resource guide for members. So we did share that with our team, if they do have any questions as far as like, hey, I want to breastfeed, but I'm not too sure, or, I don't know where resources are available. Maybe, they're aware of WIC, but also, hey, there's Baby Cafe. We have other resources that are available to you within your area. We provided our team with that information. So if members do have any questions throughout the outreach calls, we have that handy. And then again, we provided our team I believe it was a different resource guide, but different links or the hyperlinks as well for us to gain more information if needed. But again, we do try our best to help our members, answer these questions, or at least, refer them to different resources within the community. And then just overall informing our members of this program, that they have access to the portal. We have our member rewards programs, as well as free transportation. So if they do have a medical appointment or need to receive any medication, they're able to contact us, and then our transportation department is able to provide them with a ride to their appointment and then back home as well. And here we just have our provider search tool. So here members are able to find an OBGYN and, has the information according to their area or depending on, what they prefer. And again, it's on our website. So they're able to search it, put, their area code, and then search zip code, I'm sorry, area code. And they're able to search a doctor within their area. So that's also available for them. And that's pretty much it. So again, the presentation does have different links. Again, most of them are for our website, but it will take you directly to the different resources, discussed. And again, with this program, we continue to do the outreach for our members. We do have different populations that we focus on, along with one of our other departments. So we continue to do, the outreach for our members and try to, go within our community to let our members know just about the program overall. So Thank you so much for your time. Are there any questions or anything? And I can leave my information as well in the chat. So if anyone wants to reach out or, has any questions, again, I can leave my information in the chat. So thank you again. Thank you, Jasmine, for this time.
Bania, I just wanted to say, I think I normally communicate with you by email for my prenatal classes at Kern Medical.
Yes.
And finally, yesterday, I got the updated flyer. So tomorrow I will send that to you.
Okay,
the next
awesome.
classes are not until September, though, because I'm actually out in August.
Oh, okay. Yeah, and I
But
know
I'll
you
get
mentioned
that
it
sent to
too.
you.
Yeah, thank you. I know you mentioned it during the email, so I did let the team know if our members did have any questions, that there would be no classes in August, and then you would provide me with that updated one. So awesome.
Right.
I don't have to bug you again by email.
No, I have a list of people I need to send it out to, and for some reason this time it just got really delayed. It got lost in somebody's email pile, but we've got
Okay.
it sorted. I've got it as of yesterday. I'll send it out tomorrow.
Okay, awesome.
you.
Thank you so much. I appreciate it.
Thank you.
And Janet, would you also mind sending it over to me so that I can send it out to the coalition members?
Yeah, I'll do that. It'll be tomorrow in the afternoon. I'm not going to be at my desk before 4. So it'll be after that before I get it sent out, but I will.
No worries. Thank you, Janet. And then sorry, I cut off somebody. So if you have a question, please.
I have a quick question. Is there any age restriction when it comes to joining this program? Like I said, I work with minors, so I work from anybody between the age of 12 up to 22. So I just wanted to confirm if there is an age restriction.
So we do outreach to our teens, and maybe Flor, you can verify the age for our teens, but we have had as young as 15 that we do the outreach to. But I'm not sure. I'm not 100% sure if we'd have like an age restriction or age limit. So maybe Flor can chime in.
Hi, good afternoon. No, we don't have an age restriction as far as minors. It just gets a little bit more difficult as to getting the minor on the phone. And that's pretty much our barrier as far as the phone outreach. For our mailings, we do send those only to adults, so 18 and over.
Okay. Another question. If a minor does want to join the program, do they need parents' consent to do so?
Member can definitely self-refer if they want information on any of our rewards, on any of that information, and then at that time we'll ask them if they would like to opt into the mail for the pregnancy guides.
Okay, thank you.
Bania, I have a question.
Yes.
So if any of your patients need breastfeeding support, so do you have anybody in the Kern health systems to refer them to, or do you just use the breastfeeding resource guide that's provided by Jasmine?
So we provide them the information with the resource, but if they do need any assistance, for example, if they're like, hey, are you able to assist me with calling a WIC or even, Baby Cafe, we're able to provide that assistance with having a member on the phone and guiding them through the call if needed. But again, we do provide them with that information, but we don't necessarily have like a go-to where, if they do need that assistance with breastfeeding, like this is our contact. So, and for the most part, I think it's worked out great with sharing that information with the resource guide, because for the most part, what we hear a lot from our members during the calls is, yes, they receive WIC, but they're not very aware of other resources in the community. So they know that for the most part, they may have that support at the hospital, but they're like, hey, I didn't know that they had, the virtual classes, or I didn't know that they had, a group going on. And, that's good to hear. So we let them know. We do ask them that question during the prenatal call. And again, they still may be unsure. We provide them with the benefits. We do also have a link on our website with resources for breastfeeding. But then again, they do get that question asked again during the postpartum call. So during that time, we'll get a better idea, of course, if, you know, the parent is breastfeeding, if they're having, you know, any difficulty, anything like that, then, you know, we're able to guide them as well. Or even if they have any questions for, you know, breast pumps, things like that. But I feel like with just providing them with, you know, like, hey, I didn't know about it. That's good to know. They'll make note of it, any phone number information and all of that. They'll, you know, they take it very well. So.
But you do provide breast pumps, right?
We do provide breast pumps if they do have a prescription from their doctor, correct, Flor? If you want to also kind of chime in there.
Yeah, primarily we do refer them to WIC for any breast pump needs. And then at that time, if it's something medically necessary, then we do need that paperwork from the provider.
Okay, so then who does the assessment for what kind of breast pump they need?
We would defer to the provider or to the lactation specialist at WIC.
Lactation specialist where? Sorry.
At WIC.
Okay.
I have a thank you first of all, Bania and Flor, for clarifying those, you know, what your resources, and aside, you know, clarifying the lactation resources aside. I think you're absolutely right. You know, aside from WIC, there are so many resources that many people aren't aware of. And I'm wondering, this going back to the prescription form that they would have, that the provider, they would have to receive, the patient would have to receive from their provider. Is this a form that Kern Family Health Care is providing, or is this something that the provider just kind of makes a note of it and then it gets?
Yeah, it's all submitted through the provider portal.
Okay. So, and the reason I ask is because when I go out to provider visits, I, you know, refer them to WIC and also to the Medi-Cal, you know, for breast pumps. But it's good to know now that I can just direct the providers to the portal, and that way they can submit those requests. And
yeah, the requests actually go through our utilization management team, not through health education. So they would put in, it's more of a referral for that product.
Okay. Utilization department. But you mentioned it's all on the portal, is that correct?
That's correct.
Perfect. And I do want to say, for those that, because I know providers, they do like virtual or digital referral forms, but also printed ones. I do have some. Currently, I only have some for Hygieia. So if you would like those printed ones that, you know, your staff, either an IBCLC, which is an international board certified lactation consultant, or a provider, you can make those, you know, prescriptions out for the Hygieia pump. So I have those in print in case anybody would like some in English and in Spanish. Any more questions?
Yes, I have a question regarding because the mode that your guys are giving, because you said a lot that it's over the phone. Because I do come across a lot of, you know, farm workers who have a lot of barriers. Are they more than welcome to come, you know, to do it in person as well? If, you know, they have to do, if you guys have to do follow-ups, or they need to sign something and they just don't understand it, are they able to, you know, go into the office and get help?
If this is regarding our telephonic outreach, it is over the phone. We don't really have a system set up to see our members in person for this particular program. But if there are questions, for example, about the prenatal reward form, that is something that they could come in. It does require their provider to sign off. So a lot of times that's where kind of their route, they'll go back to their provider, get the sign off on the visit, and then the provider themselves will usually fax the form in, but they can also drop it off.
Okay. Thank you.
Yeah, and then if I can just add to that too, if we do any referrals for our members to any of the programs, we're able to just get their consent, a verbal consent over the phone. So we assist as well with, doing those referrals, sending them over, and again, with them, if they do want any follow-up or anything like that, or are just like, hey, can I give you a call in regards to, whatever it is, then we do provide them with our, direct phone number. But again, we help with those referrals on our end. So we complete them, send them over, and then they may, follow up like a few weeks later. Hey, I haven't heard anything. And then we're able to, again, assist with following up. So we don't necessarily need any signatures when we are doing those calls, but when we do the referrals, if needed, then we'll receive that verbal consent. So again, if they request that we do mail them that prenatal form, we're able to mail it to them, they send it back to us, and then they may want to follow up, but there is contact information on the form as well. So.
And just to add to that, we really try to promote community programs that do have that ability for that in, face-to-face interactions. So like Bania mentioned, referring them to Nurse Family Partnership, Black Infant Health, Perinatal Outreach Program that can really handle that, week-to-week case management. And they've been also a great support in like getting anything submitted for our members.
Thank you.
That's a great point, Flor. Thank you for mentioning that. And also, any more questions for Bania or Flor? And if not, I mean, you have their contact. I'm actually going to be sending out a contact list for all our coalition members. So if you'd like, you can click the link in the group chat or in the chat and if you haven't already, and it's just going to be asking for general contact information. So if you don't mind just filling that out so that I can make that list and everybody can have everybody's contact within our coalition.
Jasmine, can you hear me?
Yes.
I'm so sorry. My machine is saying that I'm muted and I'm not, so I apologize. If you were hearing background noises, I might be cutting up fruit salad to take to a friend, so I apologize. I just want to say what a wonderful program from someone over in East Kern. What a blessing to have be able to give those things to those clients and encourage them to have these healthy babies. So really incredible, from the gift cards to the wonderful care provided to, during pregnancy, after. I just want to congratulate and thank everyone that's a part of that. That's just wonderful. That's it.
Thank you, Lori.
Thank you so much, Lori, for your kind words. And if no one has any more questions, we're going to go ahead and move on to the next task on our agenda. And I'm going to go ahead and, so the next is just, I was going to go to roundtable, but I do want to make these quick announcements. As you know, National Breastfeeding Month is literally next month. We're like weeks away, and we just got a really good news. So I just want to kind of mention this. If you can put on your calendar, save the date for August 26th, which is a Saturday. We haven't determined the times, but we're hoping to have a resource fair / movie. We're going to be showing a movie. Some of you may be familiar with the Milky Way. It's a documentary on breastfeeding, and it's about an hour and a half. We're hoping to watch the whole thing, but if not, at least some of it, and then have participants go in and get resources. So more to come on that, but it's going to be hosted at the Beale Library, August 26th, which is a Saturday. And then my second announcement is regarding Unite Us. some of you may be familiar with Stephanie. She's been joining us and trying to help us with starting a digital refer system to join Unitas so that we can refer out to those that are on the platform. For example, First Five is on their platform and we can refer back and forth. More to come on that. I just wanted to let everybody know that we wanted to put it up on the coalition website, but unfortunately there is a fee to be able to have a referral page and be able to send, for people to go onto that page to refer themselves. And it is a $40 fee. And I believe it's good for 5 years. So the good thing, it's not super expensive, but if you guys have any ideas on how we can, put that money together so that we can start having our community partners, our community members refer themselves to the coalition Unitas platform so that we can connect them to community resources, but vice versa, connect them to specifically, within our network. So just wanted to put that in your guys' ear, and you guys can email me, or if you guys want to share your ideas now, you're more than welcome to, but yeah. And if not, we can move on to the roundtable announcements. And if anybody wants to share any events or their program, just kind of something that's going on, feel free to unmute yourself and share.
So I wanted to share that the CalFresh Healthy Living team is going to be hosting our National Farmers Market Week celebration and resource fair, August 12th. That is a Saturday from 8:30 to 11:30. I can share our flyer right now, and we're going to be sending out an updated flyer with all of our partners' logos, so everyone kind of knows who's going to be there. And I think Jasmine Wick is going to be there, so I think you'll be getting that flyer soon too. But we're really excited to just promote the farmers market. It's the only market in Kern County that does market match. So for people who receive EBT benefits, they can get matched up to $10 for fresh produce. So if they spend 10, they get an additional $10. So for new parents, it's really helpful. There's going to be a lot of fun activities and stuff for the kids. So I will share that flyer, and I hope you guys can share it with any of your clients as well. Thank you.
Thank you so much, Devaney. And if you don't mind, for those of us here in the meeting today that we're not familiar with Market Match, can you tell us a little bit about that?
Yeah, so it's a program that was created specifically for people that receive the EBT or CalFresh benefits. So the F Street Farmers Market in downtown Bakersfield is the only one in Kern County that does it. If you use your EBT benefits, you can get an additional $10 to spend on fresh produce. So it's one of the only farmers markets that currently takes EBT benefits, and it's the only one that does the additional market match thing, where if you spend $10, you get an additional $10 to spend on fresh produce.
Thank you so much. And I do want to just piggyback on what you just said, from what I believe someone on your team, Diana, mentioned. For those that there's actually a CalFresh or an EBT booth at that farmers market. So as you're walking in, you check in with them, and then they give you coins, like little wooden coins. And then from there, you can purchase extra, $10 worth of fresh produce with that. So just to kind of, because I couldn't wrap my head around it. I was like, how does that work? Do they get a gift card? Do they get money right then and there? So thank you again, Devaney, for sharing.
Yeah, of course. And, we try to promote that as much as we can, especially with how expensive groceries are right now. Any little thing helps. So California City is the other market in Kern County that does EBT benefits. So for anyone out in that part of Kern County, they're the only other market that accepts EBT.
Thank you, Devaney. And if you wouldn't mind, if you haven't already, on that link in the chat. If you could share those flyers that you had mentioned, and I will email those out to the coalition after this meeting. Thank you. Anybody else have any announcements or wants to share anything? If not, I do have something to share. I'm going to go ahead and share my screen. So for those of you, we came out with these infographics on after pregnancy and infant loss. A lot of our community members don't know that WIC provides 6 months of food benefits after the loss of a pregnancy or infant. And I can send you this digitally, but also we have them printed out. So if you could email me, I will put my email in the chat as well. And I can provide you with printed English and Spanish, and just give me a quantity. I really appreciate that. On the back of the infographic, it does have both of the WIC agencies and the locations. This is really important for us to let our participants and our clients know that we do encourage them to go to the nearest WIC. I know that during the pandemic, we were doing mostly virtual appointments. Now we're shifting and we're doing more in-person appointments. So it may be a barrier for somebody that's, living in Arvin and driving to Bakersfield. So there are clinics in Arvin and Lamont. Specifically, it is Clinica Sierra Vista. So that's just something to keep in mind. If they do want to, if they end up going to another clinic in Bakersfield, unfortunately, they won't be able to assist them because they're already in with Clinica, right? And vice versa. If they're with CAPK, I mean, unless that participant, because they have the right to switch if they choose to, for whatever reason, that is their right, but we just want to encourage them to go to the nearest WIC so that it's, less of a barrier for them. And I also want to point out that for those that would like to donate their breast milk, there are 2 milk banks here in California, the Mother's Milk Bank in San Jose and the milk bank in San Diego. And they can choose whichever milk bank they'd like to, donate to. They would just connect with them either over the phone and they'll walk them through that process, or they can scan that QR code and it's all online. Lastly, there are additional resources for those that have suffered, are going through that need that support, right? So there are hotlines on here, international and national, and we do have a local organization, Noel Alexandria Foundation on there. So there's their QR code and their number. If you have any questions, I'm more than happy to answer them. Or if anybody would like to share.
Yes,
I
I would. Oh yeah,
ahead.
go ahead. No, you go ahead.
Sorry. No, I just wanted to, I don't have a question, but I wanted to share too. I know that I believe I did get that from you during one of the trainings, I believe, Jasmine. And so we did share it with our team as well. And because, sometimes during these calls, we do, contact our members, and maybe we don't initially know that maybe, baby passed. And again, we start off the question like, hey, well, not hey, but, just if you recently had a delivery, and if they mentioned, yes, I did. And then we get to ask, a few other questions in regards to baby. And then that's when we find out like baby didn't make it, or, whatever the case is. And so with having this resource here, we're able to, again, provide them with that information, as well as, any benefits that may be still provided through WIC. Because I think the initial thought, right, is like, well, I may not qualify, or am I able to have any, or getting assistance afterward. But again, I personally have had, cases where, again, I do the calls and we get to maybe the breastfeeding question. They're like, well, no, unfortunately, my baby passed away. So then we're like, hey, well, there's this foundation that's able to, assist you. Or again, just having that handy as well during the calls, because sometimes it rarely happens, but it does. And again, I think with having these during our calls for our team is very helpful. Again, we're able to provide our members with the information as well, because maybe they aren't aware, or again, that's I can only imagine, it's a very difficult time, but maybe just having that phone number when they're ready, able to call and have that available to them too. So I think it's great. I like the way that it was put out. And again, we have that with provided to our team too. So we can use that information. So thank you.
Of course. Thank you so much, Bania, for all your feedback and for, sharing that with the team. You're absolutely right. This is something that sometimes gets swept under the rug, right? And I do want to also mention that for those, I can also provide you with the WIC income and guidelines, so that way you guys have an idea when you're talking to a client. Hey, you may qualify. This is an example of, for a household of 4, a household of 2. It does count if they're pregnant. It's a household of 2 if it's just mom and baby, or the birthing parent and the baby. I also do want to say that the outcome of the pregnancy does not, they're eligible if it were a miscarriage, a stillbirth, abortion. All of those account. All we do over the phone, we do ask, but it doesn't, whatever the case was, they will qualify as long as they qualify for WIC, and as long as there's a proof of pregnancy, and they can get it, a variety of ways. Specific, I think the best way would be through your provider. But yeah. And then we also encourage them to, if they haven't already gone to their provider for aftercare, after suffering something like that. But thank you again, Bania. Any more questions on that? Or something different? I know we shared a lot of information, and it's a lot of amazing information, like Lori had mentioned. If there isn't any further questions, we can conclude here. And please, I ask you to please fill out that form. Again, I'm going to sound like a broken record, because it just helps us collect your contacts so that we can distribute it amongst the coalition. And our next meeting is a month from now. It's going to be the second Wednesday of August, which is the 9th. And it's still at 1 to 2:30. And we'll be sending out, we're going to make that correction so that you guys don't have to type in a password. It'll just let you join on. But yeah. And anything on your side, Janet?
No, nothing on my side. My team has been a little bit decimated because of sick leave, but hopefully some at least of that will be corrected soon. Some of it's going to take a lot longer. But no, the information we've been sharing is great. Today's been great.
I'm just curious, Janet, how's the breastfeeding rates going at the hospitals now that I'm no longer in one? I'm just curious. That's something that used to be a part of our meetings, but I know due to lack of people participating from hospitals, it's hard to get.
Yeah, it got to a point. I was a one-man band giving my rates, but nobody else was there to give theirs.
Yeah.
So. And today it looks like it's pretty much the same, actually. I don't know if there's anybody else from a hospital here. Our rates are fairly static right now. Somewhere between 68 and 72% is where we've been sitting. But like I said, we've had some sick leave, unfortunately, and we are not able to give 24-hour cover right now.
Okay.
In fact, at this time, I'm the only day shifter. So
wow.
If I'm not there, then nobody is.
Welcome to my old world, friend.
Yeah, I know. I was there too when I first started lactation, and we got it to 24 hours a day, and now sick leave has tanked that right now. But like I say, some of that sick leave is short term. Some of it is not going to be short term, unfortunately. So we just have to see. At the moment, our breastfeeding rates are static, but it's a good static. It's still many times where it was when we started. But
Yay.
yeah, that's the good news. The bad news is the rest of it, but you know, it's one of those things we have to work through.
Well, one person at a time, one successful mom at a time.
Right. And that's kind of what we have to keep in mind. We can't fix everybody, but what we can do, we can make a difference with the people we can work with. And right now we have to be happy with that.
Right. Does anybody know, and I'm sorry to prolong this meeting. My last question, does anyone know what's happening at the WIC office in Ridgecrest? Any of my WIC people online?
Thank you, Lori. No problem. I was just saying in case there wasn't any questions, but we are, if everybody is available to continue, we still have 30 more minutes. But I think Priya is going to answer, has more to talk about the WIC office in Ridgecrest.
I know they lost their main person, and at the moment my mind is blank. I know they're still in office. I'm not implying that, but as of a year ago, they still weren't seeing clients in person. And I'm just curious if someone could update me what's happening in the local WIC offices, and if anyone's got any specific information to Ridgecrest in particular, I'd be appreciative.
Okay, so the Ridgecrest office is functioning, and we are seeing participants in person only for enrollments and recertifications. Rest of the services are provided through the phone, over the phone. And yeah, so we do have a nutritionist there. We have other staff like WIC nutrition assistant.
Yeah, it's Wendy Walker. It came to me. Wendy was phenomenal.
Yeah, she's still there.
Oh, I was told she left.
No, she hasn't left. I mean, she's on leave right now, but she's still there. Yes.
Oh, okay. I'm sorry. I was misinformed, Priya. Okay, well, that makes my heart happy. I was misinformed.
Yes.
Okay. Okay, well, thank you for clearing that up.
And Lori, in case you have any clients that would like to speak to an IBCLC, Priya is our designated breastfeeding expert, or IBCLC, for WIC, along with Wendy Walker.
Oh, okay. I appreciate that. I'm currently not seeing many clients, and the ones I'm seeing, unfortunately, are cash pay, but I'm still providing a service here. It's just a very slow go, which is what it is, but yeah.
Yeah, we are still providing all kinds of breastfeeding aids at the Ridgecrest WIC office. So yeah, as it was done before, like electric breast pumps and other things. Yes.
Wonderful, Priya. Thank you.
You're welcome.
And any more questions, comments, or I know some of us didn't get a chance to see the entire presentation, but there is recording, so we will be sharing. I will be sharing that out very soon, hopefully by the end of this month, or sooner. And I can stop recording.